Hello everyone and welcome. Today we're diving into the world of urology to explore a condition known as bladder papilloma. This growth, while often benign, requires careful attention and understanding. Join us as we uncover its causes, symptoms, diagnosis, treatment, and more. So, what exactly causes bladder papilloma? While the exact etiology isn't always crystal clear, several risk factors have been identified. The most prominent culprit is smoking. Cigarette smoke contains carcinogenic chemicals that, when absorbed and excreted through the kidneys into the bladder, can damage the bladder lining and lead to the development of papillomas. Other contributing factors include exposure to certain industrial chemicals, such as aromatic amines found in dye, rubber, and textile industries. Chronic bladder infections and long-term use of certain medications like cyclophosphamide can also increase the risk. In some instances, genetic predispositions may play a role, making certain individuals more susceptible. Now, let's understand how bladder papilloma develops. The process begins with damage to the urothelium, the lining of the bladder. This damage, often caused by the factors we just discussed, triggers abnormal cell growth. These cells begin to proliferate, forming small, finger-like projections, which are the papillomas. These papillomas are typically non-invasive initially, meaning they are confined to the inner lining of the bladder. However, without timely intervention, they can potentially progress and become cancerous, invading deeper layers of the bladder wall. The likelihood of progression depends on several factors, including the grade and stage of the papilloma at the time of diagnosis. When we look at the bigger picture, understanding the epidemiology is crucial. Bladder papilloma, like bladder cancer in general, is more common in men than women. The risk increases with age, typically affecting individuals over the age of 50. Geographically, certain regions with higher rates of industrial exposure may show a higher prevalence. Socioeconomic factors also play a role, as smoking rates and access to healthcare can influence the occurrence and detection of the disease. Studies show that smokers have a significantly higher risk compared to non-smokers, highlighting the importance of smoking cessation. What are the signs and symptoms to watch out for? The most common and often the first noticeable symptom is hematuria, or blood in the urine. This can be visible, making the urine appear pink or red, or it can be microscopic, only detectable through a urine test. Other symptoms may include increased urinary frequency, urgency, painful urination, or the sensation of incomplete bladder emptying. It's important to note that these symptoms can also be associated with other conditions, such as urinary tract infections. But any persistent urinary symptoms warrant a prompt medical evaluation. The diagnosis of bladder papilloma typically involves a combination of tests and procedures. The initial step often includes a urine analysis to detect blood or abnormal cells. Urine cytology, where urine samples are examined under a microscope, can help identify cancerous or pre-cancerous cells. Cystoscopy, a procedure where a thin, flexible tube with a camera is inserted into the bladder, allows the urologist to visualize the bladder lining and identify any papillomas or abnormal growths. If a growth is detected, a biopsy is usually performed, where a small tissue sample is taken and examined under a microscope to determine whether it is benign or malignant. Bladder papillomas can be classified based on their appearance and the degree of cellular abnormality. Some classifications may focus on the presence of dysplasia, which refers to abnormal cell growth that may progress to cancer. The stage and grade of the papilloma, determined through microscopic examination, are crucial in guiding treatment decisions. Stage refers to the extent of the tumor's spread, while grade indicates how abnormal the cells appear under the microscope. Low-grade papillomas are typically less aggressive and have a lower risk of progression compared to high-grade papillomas. Treatment and management options for bladder papilloma depend on several factors, including the size, location, grade, and stage of the papilloma, as well as the patient's overall health. Transurethral resection of bladder tumor, or TURBT, is a common procedure where the papilloma is surgically removed through a cystoscope. Following TURBT, intravesical therapy, which involves delivering medication directly into the bladder, may be used to reduce the risk of recurrence. These medications can include chemotherapy drugs like mitomycin C or immunotherapy agents like BCG. In some cases, especially for high-grade or recurrent papillomas, more aggressive treatments like radical cystectomy, which involves removal of the entire bladder, may be necessary. While we can't entirely eliminate the risk of bladder papilloma, there are several preventive measures we can take. The most important is smoking cessation. Quitting smoking significantly reduces the risk of developing bladder papilloma and other forms of bladder cancer. Avoiding exposure to known carcinogens, such as aromatic amines in certain industries, is also crucial. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, can contribute to overall bladder health. Staying well hydrated helps flush out toxins from the bladder. And finally, regular check-ups with your doctor, especially if you have any risk factors or experience urinary symptoms, can lead to early detection and intervention. The prognosis for bladder papilloma varies depending on the stage grade and recurrence rate. Low-grade non-invasive papillomas generally have a favorable prognosis, with a high likelihood of successful treatment and long-term survival. However, recurrence is common, so regular surveillance is essential. High-grade or invasive papillomas have a less favorable prognosis and may require more aggressive treatment. Recent research is focusing on developing new diagnostic tools and therapies to improve outcomes for patients with bladder papilloma. This includes exploring targeted therapies that specifically attack cancer cells, as well as immunotherapy approaches that harness the body's immune system to fight the disease. Continued research and advancements in treatment strategies offer hope for improving the lives of individuals affected by bladder papilloma.